Hello everyone, and welcome to part 2 of a special orthopedic program on teams and orthopedic specialty hospitals. I'm here with my orthopedic colleague, Dr. Eric Lebby, and our whole staff. So thank you for staying, and we have a bunch of topics to cover. But Eric, you know what? Before I get started, I wanted to, I took a flight to Boston about 3 weeks ago, and I couldn't help but think. I had to show up at the airport 2 hours ahead of time. And it reminded me of a surgical patient that we do. We have to show up 2 hours ahead of time. And why? Because they prepare us. They make sure we're wearing the right clothes. We don't have the wrong thing. We can walk. We might need a wheelchair. We might need something. They escort us through and they want to prepare us for the flight. So then we go and we wait. And that's what we do in the OR. They wait for the next patient to get out. And then you know what happens? They load the plane and we start to climb. And that's when our transport staff takes them to the OR. And they're on the way to the operating room, and they get to the room and they're greeted just like they are on the plane. They're put on the table, and then they're in the seat on the airplane, and then the procedure starts, okay? So then the plane takes off, and you see there's lightning there. Well, a lot of things, there's lightning in the OR, and we sort of take care of it. The flight took an hour, and that's about what the majority of our orthopedic cases take. And then after that, everything's calm, everybody helped, and then we're sort of on the descent, and that's when we sort of wake the patient up, we put the dressing on, we put the sutures in, and then they land in the recovery room. And I said, it's almost analogous to all the steps that we have in the operating room.
Can I stop you there for a second?
Go ahead, please.
I see it that way, but I look at it a little differently, right?
You always do.
Exactly. So everybody can take a plane flight, right? Everybody can handle start to finish. You're struggling, but it's a hell of a lot different if you're in first class. It really is, right? Right? So if you have a first class ticket and you have American Express and you can sit in the Admiral's Lounge before you don't have to deal with the hub. Oh, and if you have TSA pre or the new thing where you use the eyeball, you don't even have to get in line, right? So there are different choices that we make and different choices that a patient can make. So as a guy who flies, I much prefer first class, right? So if I'm a patient, I think it's important for that patient to understand there are different choices that you can make.
And
right?
we only have first class.
That's it. Our plane has private.
This is private.
First class.
You're right.
So that's the first thing I thought of when I saw
That's right. It's private.
Your plane.
You fly
there.
private at Lehigh Valley Orthopedic Hospital.
Right.
So you are absolutely right.
Right.
Luann, where's Luann? So Luann, you've been around 2 or 3 years now?
2 or 3.
You've been in the old system, the new system. Take it away. Tell us what you think.
So what I think is when you're at a level 1 trauma center, like you said, there's a lot of things going on. When you are at a specialty boutique hospital, it is focused on the patient. It's focused on the patient's experience from the time they get scheduled for surgery through the time that they work through it. When you look at the staff that touches each aspect of that patient's experience, they are dedicated to making sure that that patient has the best outcome ever. They are looking at those patients as they are their mother, brother, sister, parent, anything. They are looking to give them the experience that they would give a family member the experience. They are dedicated to making sure that they come out with the best outcome.
Well said.
Yeah, and Luann, how many times you call me a week with things I have to do or
So do you
haven't
see
done?
this phone? So this phone is dedicated to physicians. You need to do your H&P, get here a little early, don't want to stop the flow of the day, get here, sign your consent, make sure everything's ready. We check, double check, triple check, 4 times check that you are the right patient, you're having the right surgery with the right doctor, and everything is in line. And sometimes the doctors have to get in line. So they need to make sure that they are there and did everything to ensure that that patient too has what they need. So it's not just everyone in this room.
So what Luann's saying is you and I aren't exactly easy to deal with. Right?
So you're the air traffic controller, is that what you are? The air traffic, and there's a lot of congestion.
That's right.
And you have to calm them down and maybe send them around to calm down. Take a big 50-mile loop because you can't land yet. There's someone in the OR, just relax. And I think that's right. I think that's absolutely right. So, I mean, since we're talking about people that have been around for a while, Tom Witter. Tom Witter has been around as long as Luann or more. So, Tom, you know as much as Eric and I do about the two systems. You know, you've been doing trauma, doing joints. You know, you're like the silent co-pilot. I mean, you've been around forever. Give me your impression on the evolution of the facilities, the people, the family.
You start, 40 years ago, it was all the big hospital systems, and that was the standard. And over the years, to see where it's progressed now, it's just, why did we do that for so long, the old-fashioned way? The new hospital is just so much more efficient. Staffing-wise, in these hospitals, and we've worked at a number of them over the years, you find that overall the staff, top to bottom, vast majority are at that specialty hospital because that's where they want to work. They want to be there. They've had the experience with the bigger hospitals. They want the specialty hospitals. So as a result, they want to be there. The care is so much, it's more efficient. It's just, you can't beat it. You can't beat it. And over the years, if I've had to have a procedure done myself, that's where I want to have them done.
You know what I notice, Eric, when we open up these micro hospitals, they don't, if we go there and work, we realize how good you guys are at the home base. And so, I've opened up a couple different centers, and when you go there, the quality is good, but you know why it's good? Because we bring you guys there until it's perfect. So we bring you guys there, and professionals appreciate that. They appreciate that because, everything is about efficiency, about doing a great job. The longer you're in the operating room, the higher the risk, the higher the complications, the higher the infections. And so, you guys are not only great at the hospitals, but we've tagged, some of you to go to different hospitals, and then we could spread that expertise.
It's funny you say that because I experienced that firsthand. And they for years, they wanted me to stay at Cedar Crest, which is our main hospital, to continue to build the orthopedic program there, and I would have 2 rooms and that. And all of a sudden, they started with Tillman, and I noticed all my best nurses were leaving. They were leaving me. Where were they going? And these are people that were at Cedar Crest for years, and all of a sudden they're gone. Why? For exactly what you said. You take the best and you put them in those micro hospitals, and that's the only way those places succeed. And that's why for 15 years it's built up to what what people like Luann and others have created, literally created from the ground up.
But you know what the environment is cool about is we have all types of people come to the OR. We have some people come as second careers. We have policemen that come in that say, this is my second career, and they got their nursing degree and they're happy there. And then we have younger people that come and they start, at the bottom as a technician, and for some it's a second income for their family. For others, you can just tell they want to do more. And we have examples here. I have 2 great examples, but Ashley, was great. She just caught on, and you knew that she had great hands. She knew the procedures. She could sew, and she wanted to do more. And so our orthopedic specialty hospitals afford her that opportunity. So Ashley, tell us what drove you and how the hospital helped you advance.
So I started with the hospital 13 years ago as a surgical tech, fresh out of school. They gave me the opportunity. I worked with Dr. Meade from the beginning. Then I decided I wanted to go back to school for first assist, and of course they helped me along with that. I got all my cases in. I was able to go through the entire process and had a lot of help along the way.
So now when people come in and they go, Dr. Meade, my incision is beautiful. I love it. And I just put my head down. I didn't do that. They said, excuse me. I said, I didn't do that part. I said, I do everything, but at the end, and I said, the people that do it better, and our PAs, our first assistants, they do that job better. So we delegate. And a lot of surgeons don't. They don't do that. But you have to appreciate the skill set and then delegate it.
And I have, my two PAs are fantastic, and my ortho tech.
I see one of them hiding up
She
there.
is, but don't
No?
pick on her. No, don't pick on her. She's wonderful, and I think you were in plastics before ortho, right? So one of the nicest things one of the reasons why I'm sought after is for my incisions.
Yes.
And it has nothing to do with
Making
me.
them or sewing them?
No, how they look,
Yes,
afterwards.
yes.
And I have to admit, a lot of it's my PA. I mean, I do everything underneath, but that skin.
Oh, yeah.
That skin and subcutaneous, you can have the absolute, you look at it both ways, right? If you have a sports car and it's beautiful on the outside and you have a lawnmower engine on the inside, it's not going to get you too far. Well, if you have a beautiful engine and it's not looking good on the outside, it's going to be just as bad to that person. So both are equally as important in different ways. So I think from start to finish, it's important.
So, great. So I have a few more people that I want to talk to, but I also want to get the input from one of our patients. So stay with us. After this break, you're going to hear from our patients and a few other of our staff members. Welcome back. We have some interesting stories from our staff at the Orthopedic Specialty Hospital, and I recognize Mike Joyce, who we recognize from years ago in trauma, and it's a mistribute to my inability to evaluate people initially, because, as you said, when people were leaving and they wanted to join teams, Mike was a valuable commodity, and I voted him down.
Yeah, he was with us.
I said. And then I said, what a mistake.
He fought pretty hard to do.
It's pretty
against
hard. I
me.
voted Mike down. I said, no, he's kind of like Tom Brady. He's that 199th pick. He'll never make anything of himself.
But then he played hard to get.
He's just
Then he
going
played
to
hard to
slow
get.
us down.
So Mike, 20 years ago, my badge didn't work, and he actually let me in the hospital. He worked with us.
Another mistake.
Yeah, another mistake, letting me in the hospital.
I don't know what I was thinking.
But it's great. But I'll tell you. So, Mike, you capitalize on everybody's skill set. And so we were looking at some innovations and some of the instruments that weren't very good. And we talked about it, during the case. Mike comes in the next day and goes, here, what do you think of this? He handed me a bar of soap that he went home and carved out a distal femoral cutting guide. And I go, oh my God, this is perfect. And ultimately we got a patent on that. So here's Mike, a surgical tech, but Mike was a motorcycle mechanic. So if you want a guy to do things very well, you get a motorcycle mechanic, but it also, like Ashley, afforded Mike, the chance to come from a surgical tech to be a first assistant. But our institution is wonderful. Mike is he's like a cosmopolitan man. He makes the best peanut butter in the Lehigh Valley. So he can't be spending all his day in the OR. So
It's true.
So when he moved over, the hospital afforded him the ability to work part-time so he could do his equally important job and health food. So most peanut butter has too much sugar in it, but not Mike's. It's very, very good. It's all natural, so it's wonderful.
That's
Mike, is this all true?
This is all true.
Is
and,
this half hour sponsored by Mike's Peanut Butter?
So Mike, give us your sort of 30-second rendition of your career trek through Lehigh Valley.
Okay, I started at Lehigh Valley in 1995. I started in the OR in 92. I worked as a traveler for a little bit, so I got to work at different hospitals with different docs. And then you two guys showed up. Worked with Dr. Lebby for a little while, Dr. Meade for a couple, 15, 20 years. And it was great. I still love what I do.
Yeah,
And you're very good at it.
Thank you.
he's very good at
Very
it.
good.
So I mean, it gets
You
me
need somebody
excited.
good with you.
I do need somebody good. But so, it's great for Eric and I to talk. It's great for you guys to talk. But I want to get a patient's input. And so John Curly Crossland has showed up here. And John, I've known
You're going to regret this.
for a long time. I knew I was in trouble when he brought in a CD that showed him doing quadruple flips on a trampoline. But anyway, John had his knee done. So from an outsider's standpoint, John, give us your impression. You heard us talk today about the teams and that sort of thing.
If it wasn't for these guys here, I wouldn't be here. My history is I was a gymnast for like 50 years. So they know me pretty well because I've had, like, over the years, I've had 15 surgeries, orthopedic different surgeries, both shoulders. I blew out both rotators. I had 3 scopes on my knee, plus an ACL. The first injury was I had a total reconstruction back in 1980 down at University of Pennsylvania. I blew everything out except the posterior cruciate. So they put that thing back together. So for, 43 years, I had 2 screws in my knee, and my knees over the years has started degenerating. And around 20 years ago, I was bone on bone in my right leg. And it got to the point where my wife needed the drugs to put up with me. I couldn't even walk like 20 feet. It got to the point where I was like, man, this is ridiculous. People would be telling me, hey, why don't you get your knee fixed? Get that thing replaced. Nah. Because as a gymnast, it's another pain. You just try to deal with it. But it got so bad that when I got to the point where I couldn't walk 20 feet, I said, man, it's time. I got to go. So when I went to see Dr. Meade, I told him, man, you're going to earn your money when you have to do this knee, because I had 2 screws in there that were there for 42 years. So just think of the calcification around those babies to get them out. So you guys that were in the operating room, I don't know how many people that were in my surgery when I went in there, but you'd remember me if you were in.
Yeah, nobody could forget you, that's for sure. So from the time you came in the morning, the part of the OR you don't remember because we had you sedated, but the team before and the team after, do you remember that part of it?
Well, the most important thing was, even before the surgery, we got a booklet, and the things you had to do before the surgery, after the surgery, and then the therapy. I mean, everything was right there in front of you. So all you had to do was follow the stuff, and you'd have a better outcome. And with me, I have a factor V mutation, blood mutation, so I get clots. So I had to get off my medication, and then they put me on different, natural medicines, which, what took the place of the blood thinner for the surgery. So that worked really well. And then after the surgery, I was good again.
So again, it's an example of our specialty hospital. We know the common complications of orthopedic patients and that sort of thing. So
The outcome was amazing.
yeah. Well, you have a great attitude. You have a great attitude. I remember leaving. We couldn't get rid of you. You kept thanking everybody in the OR. It was unbelievable. So we appreciate your feedback, John.
And my kitchen became a therapy place.
It did.
I mean, like, with your guidance,
Yes.
like you guys and the team told him what he needed to do. He just went and purchased everything needed the table,
Yeah.
everything for therapy. He did his therapy. It was
Well, he's a
awesome.
gymnast, so he knows what to do.
Well,
and
after
that sort
3
of-
months, I was running around, and before that, I could hardly walk.
John, thanks again for your
Thank you.
feedback. So, Eric, who's the surprise next?
I think I'm going to call on Lou, actually.
Okay.
Give Lou the microphone. I mean, Lou, you're with us every day. This is my rep. And, what to you go to a lot of different places and a lot of different hospitals around. And what are your thoughts on the efficiencies of Tillman and Allentown?
Well, the Tillman Hospital, all the micro hospitals are kind of the future of orthopedics. All our companies, I represent DePuy, but all of our companies are gearing our implants, our instruments, our packaging all towards the ASC, towards outpatient centers. But you guys mentioned earlier family. That starts with the patient, their experience when they get there, and that's what we get with Tillman. We do spend a lot of time with all these people in the hospital, and they are our second wives, our brothers, our sisters, and we do share a lot of good stories, some unfortunate stories. Things happen in the past and people's lives, but this whole family brings it all together, and it's really nice to have that commonality within the orthopedics within Lehigh Valley, and it's nice to see everybody really share a common goal, which is make the patients better.
We talked to a lot of the experienced staff in the audience. So we have a rookie hiding in the back, Tyler. So Tyler, you come in with a clean slate. Give us your opinion of working in specialty hospitals. You've been here a year and a half now, is that right?
Just over a year or under a year. I started last November with the Orthopedic Institute. Recently graduated as a physician assistant. And to really describe the position I landed in is of great luck, in my opinion. I mean, I've landed with a team throughout multi facilities that really focus on patient care. My job is to see patients preoperatively and then also work with the teams in the OR and see the patients then postoperatively for follow-ups. And multiple times, and a large amount of patients would come to me and say what a great experience they've encountered, especially, in PACU. They're, highly educated. They knew what they were doing, along with, additional questions for their first post-op visit. But overall, many of the times I've been told that, what a great experience it was, from the beginning to, their recovery process. And, I'm very fortunate to land with a institute and a team of professionals in order to further my experience and my education and knowledge in the orthopedic realm.
So great, Tyler. So I'm going to slide that microphone down front because whenever you did something wrong, Lele, Greg, Bobby, Katie were there, and Ashley. So, his learning curve was steep because everybody was there. So Lele, you're the picture of enthusiasm. You're the shining light in the morning when we get there at 6:30. So give us your impression of the specialty hospital, your experience.
I've been with Lehigh Valley Hospital for 21 years now. I started at Cedar Crest, and then I moved on to the Allentown Hospital. My experience has always been a great experience. While I was at Cedar Crest, I was on a general team, so I didn't have the opportunity to work with a lot of the orthopedic surgeons. But when I went to the Allentown Hospital, I started working with Dr. Meade, and the experience is great. I love the team. I want to reiterate how Dr. Lebby said it starts from our ancillary help, our people that come in the morning, make sure that the room is taken care of, that it's clean, and we have all the equipment that we need for the room, for the case. And without them, we cannot proceed with the procedure. We cannot go on. So we always make sure that we appreciate the team as a whole. From the people that open the door to when they close the lights at night. We appreciate everyone.
So I'm going to leave the final words to Eric to close the show.
Again, top to bottom, this is the place I want to be, and this is a place where I want all my patients to go, because I know that my patients are going to get the best. They're going to get my family. They're going to get our family, because that's what we are at these micro hospitals. We're all a family that works together to give you guys the best results possible.
Well said. Thanks, folks, for being with us. We appreciate your time. Join us next time.